If you've ever felt that moment of disappointment when things ended before you wanted them to, you're far from alone. Nearly 4 out of every 10 men experience this at some point in their lives. It's more common than most people realize, and it carries a weight that goes beyond just the physical moment. Well, I'm Dr. Naraya Wolf, urologist and pelvic surgeon, and if you ever face questions or concerns about your urological health, stay with us. We're here to help you understand your body with clarity and comfort. Today, we're going to have an honest, compassionate conversation about lasting longer during intimacy. We'll explore what's happening in your body, why it happens, and most importantly, what actually works to help you gain more control and confidence in the bedroom. If you've been watching my content and finding it helpful, please make sure you're subscribed. I create videos like this every week because I believe everyone deserves access to clear, shame-free medical information about their sexual health. So let's start with a simple question. What exactly does it mean when we talk about finishing two? Quickly, in medical terms, we call this premature ejaculation, and it's defined as climaxing sooner than you or your partner would prefer during sexual activity. In other words, you're not able to control the timing in a way that feels satisfying, and that lack of control is causing you distress. Now, clinically, we define it a bit more specifically. If this has been happening your entire sexual life, we're looking at ejaculation that occurs within about 1 minute of penetration. If it's something that's developed more recently, we're talking about within 3 minutes. But here's what I want you to understand. This isn't just about watching a clock. It's about how this affects you emotionally and mentally. I see men in my practice who carry so much shame around this issue. They feel inadequate. They avoid intimacy altogether because they're afraid of disappointing their partner. Their self-esteem takes a real hit. And I've actually talked in previous videos about how certain personality traits can even be linked with premature ejaculation. The anxiety, the pressure you put on yourself, these emotional factors become part of the cycle that makes the physical problem worse. And that's the thing about finishing too quickly. It creates this vicious loop. The first time it happens, you might brush it off. But the second time, you're thinking about it. The third time, you're worried before you even start. And that anxiety, it makes everything harder. Your body tenses up, your mind races, and before you know it, the worry itself is making the problem worse. So what's actually causing this? Why does it happen? Well, the truth is, it's rarely just one thing. For most men, premature ejaculation comes from a combination of physical, psychological, and emotional factors, all working together. And understanding which factors are at play for you is the first step toward finding what will actually help. Let's talk about the physical side first. One factor that often gets overlooked is hormones, specifically testosterone. We know that abnormalities in testosterone levels can affect how your body manages ejaculation. That's why, if you're struggling with this issue, I always recommend getting your testosterone checked. Now, treating testosterone doesn't fix the problem for everyone, but for some men, it makes a significant difference. Another physical factor is sensitivity. Some men simply have heightened sensation in the most sensitive parts of the penis, the glans, which is the head, and the frenulum, which is that small band of tissue connecting the head to the foreskin if you have one. When those areas are particularly sensitive, even gentle stimulation can trigger arousal and ejaculation more quickly than you'd like. It's not a flaw in your body. It's just how you're wired. But it is something we can work with. Now let's talk about the psychological and emotional side because this is huge. Stress is one of the biggest culprits, and I don't just mean stress about sex, I mean stress from work, from finances, from relationships, from life in general. When your nervous system is constantly running on high alert, it affects every part of your body, including your sexual response. Then there's performance anxiety. This is the one that creates that self-perpetuating cycle I mentioned earlier. The first time you finish too quickly, you're embarrassed. The next time you're intimate, you're thinking, please don't let it happen again. And that thought alone, that fear, puts your body in a state of tension. You're not relaxed. You're not present. You're in your head, monitoring every sensation, trying to control something that feels out of control. And ironically, that makes it even harder to last. Depression also plays a role. When you're dealing with depression, it affects both your mood and your physical function. Everything feels heavier. Your body doesn't respond the way it used to. And relationship issues, poor communication, unresolved conflict, feeling disconnected from your partner, all of that shows up in the bedroom too. Here's what I want you to hear. If any of this resonates with you, there is nothing wrong with you. This is your body and mind responding to real circumstances. And the good news is, there are evidence-based approaches that can help you regain control, rebuild your confidence, and improve your sexual experience. Not just quick fixes, but real, sustainable strategies that address what's actually happening in your body. So let's talk about what actually works. And I want to be clear, the right approach for you depends on what's driving the issue in the first place. But I'm going to walk you through several options, starting with the ones that don't require medication. First, there are behavioral techniques. These are often the first line of treatment, and they can be incredibly effective. But you do need to be patient with yourself, and if you have a partner, they need to be on board too. One technique is called the stop-start method. Here's how it works. During sexual activity or masturbation, when you feel yourself getting close to ejaculation, you stop all stimulation. You pause. You let the arousal come down a bit. Then you start again. The idea is to do this 3 times, and on the 4th time, you allow yourself to finish. Over time, this helps you recognize the sensations that come before ejaculation and gives you more control over when it happens. There's also something called the squeeze technique, where you or your partner applies firm pressure to the head of the penis when you're getting close to climaxing. This reduces the arousal temporarily and helps delay ejaculation. Now, I'll be honest, these techniques can be frustrating, especially if you're with a partner. It interrupts the flow of intimacy. But if your partner understands what you're trying to accomplish and is supportive, it can be a game changer. And you can also practice these techniques on your own during masturbation, which gives you a chance to learn your body's rhythms without the added pressure. Next, let's talk about pelvic floor exercises. You've probably heard of Kegel exercises, and they can help with ejaculatory control. But here's the catch. A lot of men with premature ejaculation actually have what we call a high-tone pelvic floor, meaning those muscles are already too tight. If that's the case, doing Kegels will make things worse, not better. What you need instead are exercises that relax and lengthen the pelvic floor. I actually have a video with physical therapist Eric Franklin where we demonstrate exercises specifically designed to help with this, so definitely check that out. Now here's something that surprised me when I first saw the research: breathing exercises. Specifically diaphragmatic breathing, those deep breaths that expand your belly rather than your chest. Studies have shown that practicing this type of breathing can increase the time to ejaculation by as much as 900%. That's not a typo. 900%. I dedicated an entire video to this research because I think it's so valuable and accessible. It costs nothing, it has no side effects, and it helps you stay calm and present during intimacy. Another option is high-intensity interval training. This type of exercise doesn't just improve your cardiovascular health, it also enhances your internal awareness of your body. You become more attuned to where you are physically and emotionally, and that awareness translates to the bedroom. One study found that just 7 minutes of high-intensity interval training per day led to noticeable improvements in ejaculatory control after only 2 weeks. If heightened sensitivity is part of the problem for you, there are topical solutions. Over-the-counter and prescription creams and sprays that contain lidocaine or prilocaine can help desensitize the area just enough to give you more staying power. You typically apply them 10 to 15 minutes before sex, and you'll need to experiment a bit to find the right amount. Too much, and you might lose sensation to the point where it affects your ability to maintain an erection. And if you don't wash it off before penetration, it can transfer to your partner and reduce their sensation too. But once you find what works for you, these products can be very effective. Now let's talk about oral medications. I want to be upfront. There is currently no medication specifically approved for premature ejaculation in the United States. What we do have are medications that were developed for other conditions, but happen to have the side effect of delaying ejaculation. The most commonly used are SSRIs, selective serotonin reuptake inhibitors. These are antidepressants, and one of their side effects is that they make it take longer to climax. For men with premature ejaculation, that side effect becomes the benefit. You take them daily, and over time, they help you last longer. There are several different SSRIs, and they all work slightly differently, so it's important to work with your doctor to find the right one and the right dose for you. There's also a specific SSRI called dapaxetine that you can take on demand, meaning you only take it on the days you plan to be intimate. Unfortunately, it's not available in the United States yet, but if you're in another country, it might be an option worth exploring. And there's actually a new medication currently being studied specifically for premature ejaculation, and I'm really excited about it. As soon as we have more clinical data, I'll be updating you all on what we know. If SSRIs don't work for you, there are a few other medications that have shown some promise. Alpha blockers like silodosin and a pain medication called tramadol have both been found to help with ejaculatory control. But again, these come with side effects, so you'll want to have a detailed conversation with your doctor before trying them. There's also a special case I see fairly often: men who are dealing with both erectile dysfunction and premature ejaculation. These two issues often go hand in hand. If you're worried that your erection won't last, you might rush through sex to finish before it goes away. And over time, that rushing trains your body to ejaculate quickly, which creates a whole new problem. In cases like this, treating the erectile dysfunction first, with medications like sildenafil or tadalafil, often improves the premature ejaculation as well. And finally, I have to emphasize this: premature ejaculation is not just a physical issue. For so many men, the psychological component is just as important, if not more so. Working with a specialized counselor or sex therapist can be incredibly helpful. They can help you work through the anxiety, the negative thought patterns, the pressure you put on yourself, and often the most effective treatment is a combination. Seeing a therapist while also doing the exercises or taking medication, you're addressing both the mind and the body at the same time. Here's what I want you to take away from this. Whatever approach you choose, give it time. This isn't a one-and-done situation. Most of these strategies require several weeks, sometimes even months, of consistent practice before you see real improvement. And that's okay. Healing takes time. Learning takes time. Building new habits in your body and mind takes time. But the effort is worth it. Because this isn't just about lasting longer in bed. It's about reclaiming your confidence. It's about feeling present and connected during intimacy. It's about not carrying shame or anxiety into something that's supposed to bring you joy. You deserve to feel good in your body. You deserve to have a fulfilling sex life. And if you're struggling, please know that you don't have to struggle alone. There is help available. There are solutions that work. And there are doctors like me who want to support you through this without judgment, without shame, just with care and understanding. If this video was helpful, I'd really appreciate it if you'd hit that subscribe button. It's free, it takes just a second, and it helps me reach more people who need this kind of information. And as always, I want you to take care of yourself because you are absolutely worth it.